Good evening, everyone. Thank you so much for joining us this evening for our Wellness Masterclass Genetics Series. We have Rachel Mador-House this evening, our certified genetic counselor, who is going to present with us what to expect when you're expecting, a genetic counselor's perspective on family planning. So if you will please help me in introducing Rachel. Thank you so much, Rachel.
Thanks so much, Sierra. So very nice to be with you again. My name is Rachel Mador-House. I'm a certified genetic counselor, and I've had the pleasure of working at Ironwood Cancer and Research Centers for just over a year now. Now, before I was with Ironwood, I actually spent quite a few years working in the prenatal and pediatric realm. So I'm very excited today to give you a little talk today about what to expect when you're expecting genetics edition. So with that, let's start by having just a really quick introduction about what we're going to talk about. So today, as a genetic specialist, I would like to introduce to you the concepts of what we want to do testing-wise and screening-wise before, during, and after your pregnancy. So before pregnancy, we want to talk about carrier screening. During pregnancy, we want to talk about prenatal screening and prenatal testing. And then after pregnancy, we want to talk about newborn screening. And of course, the presentation about babies. So we want to make sure we get in as many adorable pictures of babies as possible. So with that, let's have a really quick genetics review. I promise I'll keep it as simple as possible, okay? Basically, we have over 20,000 genes in our bodies, and each of these genes performs a very specific function. Some of these genes determine your eye color. Some of these genes tell us how our skeletons should grow. And some of these genes even help protect us from diseases like cancer, for example. Okay. So we have two copies of each of our genes. One comes from our mom and one comes from our dad. So we have two of everything. It's why we look like a mix of our parents, and we kind of act like a mix of our parents as well. So we get one copy of each gene from mom and one copy of each gene from dad. So we have two of everything. Typically, both of those copies are functional. They're working properly and doing their jobs in your body. But sometimes we have some of these genes that don't work properly. Okay? So scientists estimate that in each of us, we have about 20 genes that don't work properly. But the reason we don't know about it is because we have two of everything. So if one of our genes is not working, we have a backup copy. Okay? And that backup copy is usually enough to make us healthy. Okay? So we can have these broken genes, but because we have this built-in backup system, we don't get sick and it doesn't cause us problems. That's also called being a carrier. Okay? So carriers are people who have one gene that's not working properly, but the other gene is working okay. And so our bodies don't have any changes, and usually that doesn't cause any symptoms or cause any changes in our bodies that your medical providers would need to know about. Okay? However, for people that might have two broken copies of a gene or have two genes that aren't working properly, that can sometimes lead to a disease. And those kinds of diseases are called recessive diseases. So the reason we want to talk about that is because the first thing that I'm going to talk to you about is what to do before you're pregnant, and that's carrier screening. Okay, so let's talk about carrier screening. Now, first, here we have an example of a mom and a dad. So if we look at mom, under mom, there are those two circles, two blue circles, and one has a check mark in it, and the other has an X in it. Okay, those are representing two genes. Okay, one gene, but both copies of that gene. So remember, we have two of each of our genes. One comes from our mom, one comes from our dad. Okay? Now for mom there, you can see that one of her genes, it's not working properly, but the other one, it's working okay. So mom is a carrier. Okay? And carriers, just like we said, don't have any symptoms. Okay? So for mom, she doesn't probably even know that she's a carrier. Okay? One of her genes isn't working, but the other one is enough to keep her safe. So she's a carrier. Now, if we look at dad, underneath dad, we see those circles as well. Dad is also a carrier because he has one of those genes that's not working. The other one is working. Okay? So this is an example of a family where both mom and dad are carriers for the same disease, meaning that they both have a non-working copy of a gene, and it's the same gene in both of them. Okay. So let's talk about what this could mean for their children. Okay. So first, let's talk about if mom passes down her genes, what is she passing down? Well, we pass down 50% of our genes each time we have a child. So we have 2 copies of every gene, and we pass down 1 to each child that we have. Okay? And it's random which one gets passed on. There's nothing we can do about it. We don't get to make any choices. So basically 50% get passed down to the children. So if we think about this from mom and dad here, there's 2 genes there. One's not working and one's working properly. So there's a 50% chance which one is going to be passed down to the children. So if mom passes down her non-working copy of that gene and dad passes down the working copy, then that child is going to be just like mom and dad, going to be a carrier, right? Going to have 1 non-working gene, 1 working gene. Similarly, if mom passes down her healthy gene, dad passes down the non-working gene, those children are going to be carriers. So for 2 parents who are both carriers, there's a 50% chance when they have a child that child is also going to be a carrier. And here you can see them passing down their genes and see that both of those kids are carriers, just like mom and dad. Likely not going to have any medical problems. It's kind of invisible being a carrier. And now what happens if dad passes on his working healthy copy of his gene and mom passes down her working healthy copy of her gene? Well, then they have a child that has both healthy working copies of that gene. And you can see in this example, this child doesn't have the condition and is not a carrier. Okay, so this child has only good, healthy working copies of that gene. So what can happen though is if in the 25% chance that mom passes down her non-working copy of that gene, dad passes down his non-working copy of that gene, then we have a child that is born with 2 non-working genes. Now, as we said earlier, our genes perform certain functions in our bodies, okay? So it's really important that they're able to function properly, or at least one of them is able to function properly. So this child has no working copies of that gene. Now, depending on what gene that is, we might see some illnesses or some conditions come up in that child. So it'd be really important to know what we're carriers for so that we can try and see, is this something that could happen within your family? Okay. So basically, if we're taking 2 parents into account, if they're both carriers for the same disease, then there's a 25% chance or a 1 in 4 chance that they could have a baby with some kind of disease. Okay. So you might be thinking, just like this woman is thinking, hey, well, if one of my genes isn't working, but my backup will take over so I don't get sick, then how will I know if I'm a carrier? Well, you likely don't know. So likely you, me, my husband in the other room, we're probably all carriers for multiple diseases. So again, scientists say that probably around 20 of our genes are not working properly, but we're carriers. So we don't know about that. So it's totally normal to be a carrier. Now, the problem though is that I would want to know what I'm a carrier for before I have children so that I can make sure me and my partner are both not carriers for the same disease. Okay? So how do we do that? We do that through carrier screening. Carrier screening is a genetic test. It's usually done before pregnancy. It's a simple blood test, and it can tell you what diseases you're a carrier for. Now, if you find out that you're a carrier for a disease, there's nothing to be concerned about. Because remember, being a carrier doesn't cause you any problems, right? So there's nothing to be scared about. Carrier screening is just seeing what's there that's kind of invisible to you. Okay? And then from there, you can talk about carrier screening for your partner too. And you can see, okay, well, what diseases might your partner might also be a carrier for? And do any of them overlap? So these diseases that we're talking about, there are thousands of them, and they're quite rare. So it's unlikely that 2 people are going to be a carrier for the same disease. But we can do a simple blood test to find out if that's the case. And usually this is offered to women who are thinking about becoming pregnant or in the early stages of their pregnancies. It can also be something that we think about for people if there's a chance that they could become pregnant, because sometimes surprise pregnancies happen. So we would just want to make sure that we get this information to people when it can be helpful for them. So you might be thinking, okay, well, what do we use this information for? Well, carrier screening is used to find couples who are both carriers for the same disease. Okay? And now, if we find that, then we can help these couples achieve a healthy pregnancy and know what kind of family planning options they might have available to them. So we can also use that information to make appropriate healthcare setups for the family during a pregnancy. So sometimes there are certain diseases that can affect a pregnancy, and we need to make sure that we're keeping mom and the fetus as healthy as possible. And it can be useful information that we use not just to help manage a pregnancy, but also help to determine, where the most appropriate place for, say, a family to give birth, for example. So there are some medical changes that we might make during a pregnancy, and certainly some options for family planning that might be available to that couple before pregnancy happens as well. So what's next? You've done your carrier screening. Everything's looking good. You and your partner are not carriers for the same diseases, or you are, but you've talked about your options, and now you're pregnant. Congratulations. Okay, so now what? So this is actually an ultrasound of my godson, Ethan. Doesn't he look cute? If you can't see the baby in there, that's totally fine. It took me a long time to be able to look at these ultrasounds and know what is going on. But basically, we're looking at him from the side. So you can see his forehead and his little nubbin nose, and then his chin, and then his abdomen there. Okay. Again, you can't see that, and all you see is an alien. That's okay. Okay, so let's talk about prenatal screening now. Prenatal screening identifies whether the baby is more or less likely to have certain birth defects, and most of these are genetic. So these tests include some blood tests. So these blood tests look at certain chemicals in the blood that give us some information about how the pregnancy is going and developing. They can also include ultrasounds. So ultrasounds are using certain waves to actually take a physical look at the baby and make sure that the fetus is growing properly, that they're meeting certain milestones that we expect, and that all of the parts of the body are growing according to what we know is normal. Screening tests can't make a definitive diagnosis, though. So we can use information from the chemical information from the blood, as well as the ultrasound, to say something's not looking quite right with this pregnancy, but we can't use that information to diagnose anything. So if the results indicate that there's an increased risk for a certain genetic disorder, or that baby's looking like, the fetus is looking like it's not developing quite right, a healthcare provider might discuss options for a diagnostic test to help confirm some kind of diagnosis or get some firm answers. So let's talk about what those are. Okay. So prenatal testing, which is different than the screening, right? Screening tells us there might be something wrong, and testing tells us what is happening. So prenatal testing is done by two ways. First way is called amniocentesis, or an amnio. It's basically a really fine needle is inserted, and a small amount of amniotic fluid is taken out of the uterus. And we do not poke babies, okay? We don't want to disturb them at all, okay? So we're stay far away from the baby and just take a little bit of the liquid, okay? And in that liquid is a bunch of the baby's skin cells. So as we know, every time we, move our skin around, a little bit of those skin cells come off. It doesn't hurt, it's totally normal. And the same thing happens for the fetus. As it moves around, some skin cells come off. It's totally normal, okay? And we collect those skin cells in the amniotic fluid, and then we can do genetic testing or other kinds of tests to see what's going on there for that baby. The other kind of prenatal testing that can be done is called a chorionic villus sampling. It's also known as a CVS. It can be done earlier in the pregnancy, and it's actually taking a small piece of the placenta. Okay, so it's sort of like a biopsy. Now the placenta and the baby actually start as one group of cells and then grow into those two separate pieces, the fetus and the placenta. Okay, so if we take a little sample of the placenta, we think that probably that's representative of what's happening for the fetus too. So by doing that, we can get some answers. What's going on? Okay, so the positive for the diagnostic testing, the prenatal diagnostic testing, is that we get answers. We can get definitive answers. What's happening? Now, the downside is that there is a slight risk of miscarriage if we do these kinds of procedures, okay? So the other procedures, the screening, where we do a blood test or an ultrasound, those are non-invasive to the pregnancy. So we're not in any way getting close to that pregnancy. Now, the amnio and the CVS, we do actually have to, go into the pregnancy and remove a small part of the liquid or the placenta. So that does carry a small risk of miscarriage, and that miscarriage risk is going to change depending on which location or which clinic you're at. But in general, it's a very small risk and something that is usually something that we talk about, but just something to keep in mind. Okay, so what do we use this information for? Okay, so we do the prenatal screening, the prenatal testing. But what do we use this information for? Well, information about the health of the pregnancy. It can help families make decisions about how best to manage their pregnancy. It can also tell us what medical changes we might need to do to increase the health of mom and the fetus. And it could impact where the baby needs to be born. So some babies that are born with complex conditions may need to be born at specific health centers that have resources that can give them the extra care that they need. Okay. So this information is very useful for families and is oftentimes, highly recommended by medical professionals to help make sure that we're giving pregnancy, mom, and the whole family, enough information and the care that they need to have healthy outcomes. So what's next? Okay, well, congratulations, you had the baby. It's a baby. So now what? So this is actually a very blurry, but this is a picture of me meeting my godson, Ethan. And he was just making these very cute little duck faces, how babies do with their little lips. And I was just completely in love with him. So this is the moment I fell in love with my godson. He's 9 now, so he's much bigger now, but I just thought that I would share how cute he was. He's still cute, but he's different now. Okay, so you have a baby. Now what are we going to do? Well, we're going to do something called newborn screening. So all babies born in the USA have access to newborn screening. It's a simple blood test that can find rare diseases. Basically, a very small poke is made in the baby's heel, and we take small drops of blood and put it on pretty much a piece of paper. Now, you might be thinking, oh goodness, I don't want to poke a little baby. Well, we try and do it when the baby's breastfeeding or when we're giving baby a nice facial massage, something like that. And babies' brains are still growing, right? So they're so small at that moment that they actually can't think about more than one thing at the same time. So if we're distracting baby with something that feels really nice, like breastfeeding or a massage or giving them a little bit of sugar water, then actually their little brains can't really comprehend that they're getting a little poke in their foot. So most of the babies that I've been around when they've had their newborn screen done don't even notice that it's happening. Okay? So what we're doing is we're taking this blood and we're looking for rare diseases. Okay? Some of these diseases can cause serious problems if they're not treated early. Okay? So the baby is born and has been sharing blood with mom. So they've been getting all of their nutrients from mom's body. So the baby might look completely healthy because they have all of mom's nutrients and vitamins and all of those things from mom going through their body still, but they can still have a very serious disease. So newborn screening can alert medical professionals to these illnesses and allow treatment to begin before there's a problem. So it gives our tiniest community members the best chance for a healthy life. Newborns are also screened for heart defects. So they get a little device put on their hand and their foot. It doesn't hurt. And it just checks to make sure that enough blood is going both up and down the body and that there aren't any problems with the baby's heart. We also do something called newborn hearing screening. And that's to make sure that we're checking baby's hearing. So a little, sort of like a little helmet is placed on the baby's head and they check for the hearing in both of the ears. And by doing that, we can identify babies that might have hearing loss. Sometimes we can reverse that hearing loss, but most times we can't. But we can start some interventions to make sure that that child grows into, the healthiest person with the most, the most dreams that can be achieved as possible. Okay, so how do we use newborn screening information? Well, what we want to do is we want to find babies that have these severe diseases that might not be apparent right away. So the idea is that we want to find them before they get sick and maybe try to start some kind of treatment so that we can prevent the baby from ever getting sick. Sounds like that makes sense, right? Trying to prevent babies from getting sick? Yeah, it's kind of a no-brainer. So newborn screening is fantastic at trying to do that. We try and find babies that have these severe diseases before they present with any symptoms, just by a simple drop of blood from their foot. And then from there, we can start some treatments. And usually those treatments are dietary changes. So it might be that baby's body is not able to produce certain kinds of nutrients that they need to survive. So if we know about that early enough, we can give them those nutrients. Okay, so most of the time, this is simply, the treatment includes just a simple diet change. Okay, we can also be talking sometimes about medications. So there are some medications that we can use to help prevent babies from getting sick. And then sometimes, very rarely, we need to talk about surgery. Okay, so if the baby was born, say, with a heart defect, it might be that surgery is the only way to correct that for the baby. So what do I recommend? Well, if you don't have children, but you're thinking you might want to get pregnant in the future, I think you should talk to your family care provider, so your family doctor or primary care provider or your gynecologist about getting carrier screening. From there, you might get some information to help tell you what your pregnancy options are and how to go about having a healthy or the healthiest pregnancy possible. If you get pregnant, then prenatal screening and prenatal testing might help determine your health, the pregnancy's health, and what options you have during your pregnancy. Once the baby is delivered, newborn screening, of course, can help detect any serious illnesses before the baby looks sick. And by doing all these kinds of screening, we can give those babies the healthiest start to life. And with that, I would be more than happy to take any questions you might have.
Thank you, Rachel. It doesn't feel like we have any questions at this time.
Great, no problem. Well, everybody has my contact information, and certainly anybody who has questions is welcome to reach out to me, and I'd be more than happy to provide any insight or direction that anyone would like.
Thank you so much, Rachel. We appreciate your presentation, and that includes our Wellness Masterclass Genetics series. Thank you so much, everyone, for joining us this evening.